Who have not seen my videos before, I have to introduce myself. This is Professor Ndubeze Okonkwo. I'm a biochemist, training in forensic chemistry, graduate studies, and I'm an internist, I'm a nephrologist, and a consultant in transplant medicine. I'm doing this presentation as part of my community service. It's so disturbing to see something that I believe was either recorded in Ghana or somewhere else concerning prostate cancer and its relationship with sexual activities. This may be very misleading to people, and I have seen that a lot of people take interest in disseminating medical information. As good their intention may seem, this may also be misleading and can lead a lot of people to death. To deal with prostate cancer, we are dealing with all fathers, all brothers, all cousins, and etc. As long as you are a man, you have a prostate gland. The prostate gland is a gland that is part of the male reproductive system, and the gland is located below the bladder and in front of the rectum. It has the shape of a walnut, and the urethra, which is the tube that carries urine from the bladder through the penis to the outside, has to go through this prostate. And so when the prostate is too big, it compresses on the urethra and the urine will not flow as it should. If there's a complete obstruction, it will cause the kidneys to swell and you have kidney failure. Therefore, what goes on in prostate is much more than prostate cancer. You have prostate hypertrophy, which is a sudden or gradual enlargement of the prostate as a result of either an infection or its gradual enlargement over a period of time throughout the rest of your life. We don't know why in most circumstances. The prostate gland, as we know, has its main function to produce the fluid called seminal fluid or juice that make the transportation of sperm across the urethra as easy as it can be. The sperm is produced in the testicles, then will be released through the urethra as it's coming down. The prostate will have to add the juice to it to make it easy for transportation. Therefore, the prostate gland is extremely essential to the human male reproductive system. Having said this, the most devastating news about prostate is that the same prostate that helps you in the reproductive system can also kill you by development of prostate cancer. There are a couple of things I want you to know from this inception before we go into any further detail to dismiss the myth. And sometimes it makes me uncomfortable enough that I call them lies. No one knows what causes prostate cancer. There are a couple of things that we may say are associated with prostate cancer. There's no literature anywhere in the world. There's no scientific study, either controlled or multi-center trials, that none has ever established a cause, I repeat, a cause of prostate cancer. There may be an association with a couple of things, but none is known as etiology. Number two is that there is nothing that has been proven by any stretch of imagination to prevent prostate cancer. None. But we know there are associations with a couple of things, some dietary, others non-dietary. Just as exercise is essential in maintaining good health in all things, good exercise is healthy to maintain good prostate health. Obesity, which is the excess weight an individual carries above what we call ideal body weight, When you have more than 15 to 20% of your ideal body weight, you are obese, you are overweight. You may look at yourself and think you are slim, but you are medically overweight. So overweight leads to all kinds of illnesses. And a lot of cancers are equally associated with obesity, and prostate cancer is one of them. The other is age. Very rare will you find a man with prostate cancer who is less than 40 years old. Most of the prostate cancers occur after age 65, which is 80% of prostate cancers you find in men over 65 years and above. Less than 1% or thereabout you will find in men that are 50 years or lower, or younger rather. Having said this, the commonest cause of prostate cancer is found among African American males. Prostate cancer is rare, it's not very common in African men who were born, grew up, lived, and died in Africa. The risk of prostate cancer in men in Africa and men of African descent that are in America, that we call African Americans, the risks are different. It is highest in African American males. It is not as much in Africa, Asia, nor Latin America. Prostate cancer is the second leading cause of cancer after skin cancer in American males, white and black. The highest death from prostate cancer is in African American males in the United States. Some people may argue that we do not have enough technology to track illnesses and biostatistics in Africa, therefore it's underreported. That factor is non-contributory. If it does, it's very minimal. To discuss prostate cancer and their symptoms, its treatments, complications, and etc. A, what is cancer? It is an overgrowth of a cell. When a cell multiplies faster than it should, the gland or any organ gets bigger and bigger and bigger. If that growth is uncontrolled, it becomes cancerous. If it is cancerous, it may end up killing you depending on the type of cancer. There are different types of cancer of the prostate, adenocarcinoma being the group that dominates prostate cancer. So when you have prostate cancer, you have heard from people in Nigeria or elsewhere, or if you come to my hospital, I have this treatment, once I give it to you, it will disappear. There is no one treatment for prostate cancer. There are many types of treatments, and no one particular one is good for all. There are many things that determine what treatment is best for you. So I will start by the simplest one, is surveillance and wait. What does that mean? If one is diagnosed to have prostate cancer, the very first thing to determine is what type of cancer do you have? Is it a slow-growing cancer or is it an aggressive cancer? Most often than not, prostate cancer is slow-growing, and slow-growing cancer of the prostate can be there for 20, 30 years without killing you. And since this cancer most commonly is found in men aged 65 and above, if it's a slow-growing cancer, most often than not, you may be better off waiting instead of treating, because every treatment carries its own complication. And if you're 65 years old when you're diagnosed with prostate cancer, and let's assume the cancer was diagnosed very early, you have 20 to 30 years before the cancer gets to a point where it's going to kill you. You would have died from other illnesses or other diseases before the prostate cancer will kill you. So most men with early slow-growing prostate cancer do not require treatment. You just observe and wait. The second type of treatment is surgery. And surgery simply means you remove the prostate gland. But in removing the prostate gland, you run the risk of causing some complications, one of which is damaging the nerve that supplies the bladder, or damaging the nerve that supplies the reproductive system itself, making it difficult for the man to have erection after the surgery is done. So two most important and most common complications are bladder leakage, or it's called incontinence, or erectile dysfunction. So if you're going to do surgery, you need to talk to the physician or the surgeon first to determine that he's going to be careful not to dissect or cut the two nerves, or the nerves that are essential for your bladder to maintain its physiologic control, where you do not have urine leakage, especially dealing with erectile dysfunction, to make sure that the nerve that helps the penis to have the erection is not destroyed during the surgery. The age of the patient obviously is going to help determine what type of surgery you do. I don't see anybody worrying about a man who is 80 years or 90 years old worrying about erectile dysfunction if you do a life-saving procedure in the patient. So you will see that the age of the patient is part of the determining factor for the kind of treatment that you choose. Within this same surgery, after it's done, there is a chance that part of the cancer cells are still left behind. Some of them may not be obvious to your eyes without microscopy. Therefore, radiation therapy can be added to it to kill the remaining cancer cells. And what is radiation therapy? Radiation therapy by itself is an independent treatment that can be used with surgery or be used alone in treatment of cancer. So if you're going to use radiation therapy, simply like X-ray. So you have two major types. One, that is the use of a machine like X-ray to direct the radioactive ray to where you know the prostate cancer cells are, and kill off the cells. Or you can have a radioactive bead in which the surgeon opens you up and then will insert a radioactive bead into the prostate itself. And then it's going to be radiating the radioactive material, radiating the cancer cells, and keeps killing them gradually until they are killed off. There are other types of treatment, one of which is chemotherapy. The chemotherapy is used. Chemotherapy is nothing but just medication that you can give by mouth, or you can give through the vein. And whatever modality you use to give the chemotherapy, its goal is to travel around the body, looking for cancer cells from the prostate and destroying them, and then killing the cancer cells in the prostate itself. This is just a mere summary of how chemotherapy works. It's much more than this in details, but I won't bug you with those. There is immunotherapy, in which one would direct the treatment to preventing the prostate gland from getting the hormonal stimulation it needs in order to grow. For instance, the testosterone, which is the male hormone produced to help with the reproductive function, stimulates the prostate gland as well as the rest of the genital. When someone has prostate gland cancer, you can treat it by blocking the effect of testosterone on the prostate gland by either doing castration, in which you remove the testicle, therefore the testosterone is not produced anymore. But who will you do castration on? 80 years old, or is it a 50-year-old? And again, you see that the age of the patient helps in determining the type of treatment that the person needs. But if you choose to use hormonal therapy, it can be used in any age group, but it depends on what modality of the hormonal therapy that you are using. Are you removing the source? Are you blocking its effect? Because you can use medication to block the effect of the testosterone on the prostate gland. And then there is therapy in which you can use cold gas using needle or probe to get this cold gas into the prostate gland, and it will freeze the cancer cells. It's not as effective as the other methods that I have just described. And then you have an ultrasound focused beam in which ultrasound can send hot waves into the gland and basically help kill the cancer cells. There are many more, but they are experimental or trial medication, modalities, such as vaccine that one can use to stimulate the immune system to help to kill the cancer cells. So in summary, what I want the public to know today is that, one, I was listening to this video from, I don't know where, from somewhere, I'm suspecting it's probably from Ghana, where someone is saying that ejaculation translates to blood loss. We know that one ejaculate contains about average of 100 million sperms. And what you need to fertilize the egg in the fallopian tube is only one sperm. So these 100 million sperms will be fighting to see who gets there first. But this is merely sperm and juice, has nothing to do with blood cells. So for someone to say that this, if you're ejaculating 100 million sperm cells, that it translates to 1 pint of blood, that's absolute nonsense. Sperms are not red cells. They have nothing to do with blood nor blood volume. You don't lose any blood if you ejaculate. And that brings me back to people saying that if I traveled to so and so place and I saw somebody eating cassava leaf or roasted cassava and ate it and the prostate cancer vanished. These are all lies. An intelligent person can verify whether a treatment works by following what is called multi-center trials or control studies, where you take 1,000 people, as an example, put them in one group, another 1,000 people with the same demographics, if you wish, or the same biometrics, if you wish, and put them in this group. You give this group the medicine you anticipate that is going to treat the cancer, and these people, you give them what is called placebo, which means you're not giving them anything. You make them believe they're taking medicine, but what they're taking is simple starch. And you compare the results at the end of however long you want to do the study. The longer the time, the better. So if you have both of them having equal survival, then the medicine doesn't work. If you have the group that is taking medicine surviving more than the group that is taking placebo, it means that this medicine works. So if you think that cassava works, get 100 people with prostate cancer, put them in one group, give them cassava, and get the other group and don't give them cassava, and then see at the end of however number of years, 5, 10 years, how many die, depending on how aggressive the cancer is. If it's a slow-growing cancer, you're going to do this study for as long as maybe 20, 30 years before you start seeing the benefit of any medication that you are giving, bearing the complications that could arise, because the cancer doesn't have to kill you before it invades your bladder, before it goes to your kidney, before it goes to your spine, before it goes to your liver, before it goes to your bones. You don't have to die for you to have these other complications. But if you are following the patient by methodology that is going to examine their organs to see whether the cancer is spreading or not, you are going to know whether your treatment is working or not within weeks to months. Therefore, if you are concerned about how to know whether you have prostate cancer or not, there is no specific thing that you're going to have and say, I have prostate cancer. However, these are some of the things, if you have them, you need to go to a physician to be evaluated to see, am I having prostate cancer? If you are 50 years and above and you're a black man, your chance of developing prostate cancer is high. If you're an African American, it's still there if you're African from Africa. 2, if you're 65 years and above, the chance of you having prostate cancer is at least more than 25%. You may have it and never know you have it and die. They do an autopsy, they find the cancer. Because if you have a slow-growing cancer, it will never cause you any problem. However, once you see You start seeing blood in your urine. You are losing weight when you don't want to lose weight. You see blood in your semen, or you want to urinate. You don't urinate as the same way you were urinating when you were 20 years old, where you can just stand by the door, target the commode, and you pee, and you go straight into the commode because it's coming out with force. When you are older, you don't have that capacity anymore because you're going to be having the stream of the urine decrease by the obstruction of the prostate that it causes on the urethra. The next is that if you finish urinating when you are 20 years old, you can pack your stuff and move away and there will be no urine left in your underwear ever. If you find yourself after urinating that you're finding urine in your underwear, it means you are having leakage, not incontinence. It simply means you're having what is called dripping. You didn't clear all of the urine when you urinated. The next is that if you go to urinate and you have the urge to urinate, go to the bathroom, you don't start urinating within 2 to 3 seconds of getting to the bathroom. You have to wait there for 30 seconds, 20 seconds. It means you have something blocking the flow of urine. The likelihood is the prostate. If you're having lower back pain, you want to make sure you don't have prostate cancer that is spreading to your back. And there are other symptoms, but these are the common ones that I just mentioned. And so, if you get nothing from this community service, I want you to know, A, there is no supplement you can get from a store. They tell you get zinc, or you eat guava, papaya, watermelon, vegetables, fruits. All these are wonderful to help both your prostate and the rest of your body. Not one single one will cause you cancer if you don't eat it, but we anticipate based on association that they may help. But there is no evidence that any one by itself helps you prevent yourself from having prostate cancer. And then, is there any known cause of prostate cancer? Absolutely none proven. There are things that are associated with it. You see people running around like this video from Ghana saying that if you have sex more than twice a week, that you run the risk of developing prostate cancer. That is voodoo medicine. It has no bearing in the scientific world. It's not been proven. There's also a suggestion that the more the ejaculation, which means the more the sex, the less the chance of prostate cancer. It has not been proven. It's suggestive. Therefore, the message is nobody knows the cause of prostate cancer. No one knows how to prevent, with absolute certainty, how to prevent prostate cancer. There is no proven cassava. There is no proven African treatment. There is no proven herb that is going to cure your cancer or prevent the prostate cancer. If you have prostate cancer and it's diagnosed, they suspect it, they do a test called PSA, prostate-specific antigen. If it is high, especially if it's 10 and above, the chance of you having prostate cancer is higher. The surgeon or any other person, a urologist, will do a prostate biopsy, taking a piece of your prostate and studying under the microscope to see if it has cancer cells. If it does, the next question is, what type of prostate cancer do you have? It's not just one type. There are many types. Each type carries a different risk of spreading because some are aggressive, others are slow. And this is the summary about prostate cancer. This is not a scientifically presented paper, nor what we call a ground round kind of presentation, in which one is going to say that this is a detailed presentation. This is just a summary. If and when you need a detailed presentation, it's going to take me at least an hour to 2 to do an adequate, scientifically presented case of prostate cancer. I'm going to close by giving you an example of what happened to a man in Nigeria. I got a call from his son that the father woke up this morning and couldn't urinate. And because the man does not eat gari, for whatever reason, there wasn't enough food to eat, and he ate gari last night, and he came down this morning with difficulty urinating. And I said, well, why don't you take him to my hospital so they can evaluate him and see if he has a urinary tract obstruction. So when he got there, they put a Foley catheter into his blood and they were able to get 2 liters of urine out, meaning he has obstruction. So the next question is, what caused the obstruction? So I asked him to go to Ibadan to go and meet a particular urologist. And this happened at Inewi, because I had a confidence in this surgeon in Ibadan based on recommendation of a trusted uncle of mine. The man went to Ibadan to be evaluated. When he got to this man, he was told he needed to pay 1.something million naira for the surgery. I'm not trying to sound my trumpet here, but he had no money, so I paid the bill. And so the man removed the prostate. So I asked the son to ask him, what type of prostate cancer does the man have? And he said, well, I'm not going to tell you unless you give me 25,000 to give to the pathologist so they can test it and see if he has cancer. Well, I paid another 25,000. You will imagine that a urologist, any surgeon that has fear of God in his head, will not remove your prostate. In America, you don't remove any tissue from anybody without sending it for pathology. But only in Nigeria can you do such a thing. So they tested it and said, well, he has cancer. Okay. I said to them, ask him how he's going to treat the cancer. He said, well, I've treated the cancer. Then what did you do? He said, ask your father. And the treatment he gave to a 70-year-old man was to remove his testicle without his consent. And he had a wife. So this is Nigerian medicine. Of course, the man went home. There was no follow-up. He told him to follow up with a local physicians. 8 months later, because this man did not do any imaging, no CAT scan of the pelvis, nor abdomen, nor chest, to see if this cancer has gone from the prostate to anywhere else. He didn't do any. Therefore, he didn't know whether there was metastasis. He didn't evaluate any lymph node. What happened 8 months later, the man woke up in the morning and couldn't get out of bed because his legs were paralyzed. What happened? They called me. And I said, well, call the man in Ibadan. I'm in the United States. They called him. What did he say? Oh, take him to India. We don't do such things in Nigeria. And then I sent them to Nigerian US Embassy in Lagos, secured visa for them and brought them to New Orleans. By the time he came here, we evaluated him because I knew what was going on with him. He had metastatic lesion from the prostate gland, meaning the cancer went from the prostate gland to the spinal cord. First, it affected the bone, and then the bone broke up. And from the bone, obviously, it got to the spinal cord. And the broken bone is now impinging on the spinal cord, and it's called cord compression. The man became incontinent. He can't hold his urine anymore. We began the treatment in New Orleans, rebuilding his bone and giving him whatever treatment that was possible, because a stage 4 cancer, a metastatic cancer of the prostate that has gone to the bone of your back, 9 out of 10 is going to kill you. It's no longer whether it will. No treatment is going to stop you from killing you. You can delay the death, but you're going to die. And so the man was sent home to Nigeria. 2 weeks later, he died. So this is a public information. It's a serious business. So listening to morons, because that's what I call them, who will go and pick up anything from internet without first analyzing it or verifying it, and then start sending it to people as a means of expressing his ingenuity in medicine. Medicine can be studied by anybody. Anybody has the ability to study medicine. You just have to invest your time, go to school if you want to be a doctor. Stop spreading false information to people because it's killing them. And finally, I will say to you, if you get medical information from the internet, verify it, give it to someone who is trained to look into that information to tell you if it's useful or not. Because you do not put a robot, don't take a roadside mechanic and put him on an airplane as a pilot to fly you to your destination. You don't do that. I know you don't. You do not take somebody who doesn't know how to drive you from one location to the other. You won't do that. You don't take your 1-year-old and put him in your driver's seat to drive you to a particular location. If you can't do those things, why do you think you can do that in the scientific world, where studies are done and evidence-based medicine is practiced based on empirical data? Thank you.